does not go away, and difficulty breathing. If you are experiencing any of these symptoms, it is advisable to stay at home until you recover, or if you want to go to your doctor, call first and tell your doctor of your symptoms, any recent travel or contact with travelers. And lastly, please avoid spitting in public. Recent cases have shown that people most likely to be at risk if they contract the virus are persons over age 60 and persons that have an underlying medical condition such as hypertension, diabetes, kidney disease, or a respiratory condition. It is advisable to avoid large crowds or other places where you might have to come in contact with people who are showing signs of the coronavirus. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis proudly announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part.
As long as the recommended precautions are taken, you can go about your daily life with immense peace of mind.
Everyone is encouraged to adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart, and always wear your mask.
Always keep your hands clean. Wash your hands with soap and water, or use an alcohol-based hand sanitizer. When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants.
Together, we can create
a safe environment
and embrace
a border reopening lifestyle.
The Centers for Disease Control and Prevention, CDC, the expert body on coronavirus, has released guidance for general public and healthcare professionals on the symptoms of the virus. A person could be at risk if they have any or all of the following: fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing after traveling to areas with positive cases, or having close contact with someone who is ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who has been confirmed to have the virus. The CDC defines close contact as being within about 6 feet 1.8 meters or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing, or having direct contact with the infectious secretions of a person with the virus without protective clothing. Coronaviruses are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
is on.
Good morning and welcome to this special NEOC COVID-19 briefing for today, Tuesday, the 24th of November, 2020. I am Les Roy Williams. I thank you very much for joining us today for this press briefing as we continue to update you on what is happening in St. Kitts and Nevis with respect to the management of the COVID-19 pandemic. Today we have with us the Honorable Keela Byron Nisbet, who is the Minister of Health, the Federal Minister of Health. We also have, of course, Dr. Cameron Wilkinson, the Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Laws, Hazel Laws, our Chief Medical Officer, Superintendent Cromwell Henry, and Mr. Abdia Samuel, the chair of the COVID-19 National Task Force. Of course, your participation in these press briefings is important, and the role that you play in adhering to all the protocols and measures is important in keeping St. Kitts and Nevis safe during this time of the COVID-19 pandemic. I would like to invite first to the podium Dr. Hazel Laws, our Chief Medical Officer, to give us a presentation on the Health Emergency Operations Center Situation COVID-19 report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good morning to everyone. This morning, it's my task to share with you this special edition of our Health Emergency Operating Center's Situation Report. Yesterday afternoon, the Ministry of Health received 2 positive laboratory reports. That's COVID-19 laboratory reports for 2 returning nationals who would have arrived in the Federation last Saturday, November 21st. So in essence, we have 2 additional imported cases of COVID-19. This brings the total number of confirmed cases of COVID-19 for the Federation to 22. The 2 returning nationals have been in quarantine since arrival. The protocols that we have established have been adhered to, and these protocols would have been followed along the corridor of containment between their arrival into the country at RLB International Airport and the hotel where they are staying. Contacts, meaning the significant contacts of these 2 cases, are presently being interviewed. The significant contacts are placed in quarantine, they're being tested, and they will be monitored. Our contact tracing system is quite robust here in the Federation. I want to also inform the general public that all passengers who would have arrived in the Federation on this same flight last Saturday afternoon, they are in quarantine and they are confined to their rooms. So let's just think about traveling and what happens. And so let's say you are booked to travel to St. Kitts, the Federation, via American Airlines or any other carrier. You would go to the international airport. You will be waiting in the departure lounge. And so you would interact inevitably with passengers who are going on the same carrier. And then once you are on board, you would be sharing the same air space, AIR space, with the passengers on board that 3-hour flight between Miami and St. Kitts and Nevis. Now, if you were to say use the restroom, other passengers on board also utilize the restroom. And then once you would have landed here in St. Kitts and Nevis, there is interaction between passengers when they are disembarking and when they are making their way through the RLB International Airport, through the health screening unit, through immigration, customs, and then as they exit the airport. And so as a result of this inevitable interaction, all passengers who were on board this conveyance, they have been asked to remain in quarantine, confined to their rooms while here or within the first 14 days of their vacation in the Federation. Now, as I said before, as at present, St. Kitts and Nevis, the Federation, we have reported a total of 22 confirmed cases of COVID-19. Now, the rate of infection, meaning COVID-19 infection per 100,000 population, now stands at 41.3. Now, this has increased from 37.6 yesterday when we were at 20 cases. Globally, based on the World Health Organization's COVID-19 dashboard, there are 58,712,326 confirmed cases of COVID-19 globally. The death toll internationally stands at almost 1.4 million. Based on the CNN COVID-19 tracker, in the United States of America, they've reported well over 12,421,000 confirmed cases of COVID-19 to date, and the death toll within the United States is really over 257,000. In the United States of America, they've noted a new record. The U.S. set another record for new COVID-19 cases in children, and that's last week. So this is coming out of the CNN. They noted that there were more than 144,000 new cases of COVID-19 reported among children in the week ending November 19th. The highest weekly increase since the pandemic began, according to an update Monday by the American Academy of Pediatrics. And so I just want to highlight that children are also impacted by COVID-19. And I also want to share with the general population that all children who come into our federation, we test them. All children, irrespective of age, they are tested. All right, so they go into quarantine, and in order for them to be officially discharged from quarantine, they are sampled and tested. So that's what pertains here in the Federation. What's happening regionally within the Caribbean region? The Caribbean region has reported 282,296 confirmed cases of COVID-19, and the death toll is almost 5,000. To be specific, it stands at 4,974. Closer home, let's see what's happening in the islands, the nearby islands. And so within the last 14 days, Antigua and Barbuda would have reported 14 cases, bringing their total to 139. Barbados would have reported 16, bringing their total to 259. Dominica would have reported 14 cases, that's newly confirmed cases, within the last 14 days, bringing their total to 77. St. Lucia reported 92 newly confirmed cases within the last fortnight, bringing their total to 223. St. Vincent and the Grenadines, 8. Grenada has a total of 41. And we see that Anguilla just had one newly diagnosed COVID-19 case within the past fortnight, bringing their total to 4. And that's Anguilla went a few months without having any cases, and so this is a new case being highlighted in Anguilla. Testing, St. Kitts and Nevis, we continue testing all persons who would come into country, all returning nationals and international travelers. So to date, we would have tested over 3,674 persons. At present, we have over 303 persons in quarantine, and some are being quarantined at home, but with Commissioner of Police prescribed security. So to date, we have 19 persons recovered. We have a total of 22 confirmed cases. Please note that the last 3 cases that we are reporting, they are imported. They are imported from the United States of America, and at present, they are in isolation. Again, if you are interested or if you have plans to return to St. Kitts and Nevis or travel to St. Kitts and Nevis, you need to go to this URL or website, knatravelform.kn. You need to look at our health and travel protocols. We want it to be guided by same, and we want it to complete the entry form. Please note that in order to come or travel to St. Kitts and Nevis, you must submit evidence of a negative COVID-19 reverse transcription polymerase chain reaction test, PCR test, RT-PCR test. Let me repeat, reverse transcription polymerase chain reaction laboratory-based molecular test. This is the gold standard, and this is the only test we will be accepting here on. So this is the official RT-PCR test. We ask that this must be done at an accredited laboratory in the country from where you'll be traveling. We want you to take this test within 72 hours of travel and upload the results onto the entry form. Please note that COVID-19 PCR home tests will not be accepted. Please note, the real-time PCR tests will not be accepted. Please note that tests or assays authorized by FDA under an emergency use authorization or EUA will not be accepted. So these are some of the many unacceptable COVID-19 test results that we have been encountering as we process the entry form. So in essence, I just want to underscore that in order for you to ascertain approval to enter the Federation of St. Kitts and Nevis at this time, you must submit evidence of a negative COVID-19 reverse transcriptase polymerase chain reaction laboratory-based molecular test result. You should also provide us with your hotel accommodation reservation, because these results and reservation will be verified before you are issued that official approval letter which is required for you to board any carrier bound or en route to St. Kitts and Nevis. Ladies and gentlemen, the COVID-19 outbreak in the United States of America continues to surge, and we continue to accept individuals coming out of the United States of America to our federation. And so by extension, the risk of importing or re-importing the COVID-19 virus continues to be extremely high. So what can you and I do to protect ourselves from COVID-19? Well, let's start with our frontline workers, those who work at the airport, those who work in terms of the ground transportation or taxi drivers, those who work on the sea taxi that takes individuals from St. Kitts to Nevis. We depend on you, or we are depending on you, to adhere to the established protocols. We want you to adhere to all of the COVID-19 protocols. You've been trained, and it's a new norm. And so we want you to be diligent and adhere to these protocols. And then you and I, we want you to adhere to the prevention and control measures for COVID-19. And these include wearing your face mask when in public spaces. This is very, very important, and it has proven to protect many, thousands of individuals from the virus. So it's very important to wear your face mask and to wear it properly. The face mask must cover your nose and your mouth. Please, when interacting closely with anyone, or when interacting with someone closer than 3 feet, closer than 6 feet, it's important to have on your face mask over your nose and mouth. Your hand hygiene, very important. Remember to use hand sanitizing solutions before entering public spaces and when leaving public spaces. Always maintain that 6 feet distance between yourselves and others, and avoid mass gatherings and crowds. Very, very important. And so we have started tracing the contacts of case number 20. We've started testing them, and to date, none are positive. So what does that tell us? It tells us that the protocols that we have established are working. And it tells us that the frontline workers, they are adhering to these protocols. And we are imploring all frontline workers to continue their diligence in terms of adhering to the protocols that have been established. And so the public health team continues their contact tracing. As I said before, our contact tracing process is very robust. And so we will continue interviewing all the contacts of these imported cases just to ensure that everyone is okay. And we are doing this to protect all of us here in the Federation. Good news. I want to end on a positive note. Pfizer and BioNTech, they have applied for emergency FDA approval for the COVID-19 vaccine on Friday. So this submission took place last Friday, and they are hopeful that COVID-19 vaccines may become available as early as mid-December this year, 2020. And I suppose it goes without saying that the high-risk populations would be the ones who would be first in line for same. The research or the data so far tells us that this front runner, so this 162B2 vaccine is the front runner, and it's 95% effective at preventing COVID-19. So ladies and gentlemen, there is hope. Thank you.
Thank you very much, Dr. Laws, for reminding us that there is hope. I now invite our Chief Medical Officer, sorry, not our Chief Medical Officer, our Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson, to give us his presentation.
Thank you, Lesoy. COVID-19 has taught us that the nations of this world are all intimately connected. It took this tiny virus, starting its journey in Wuhan, China in December 2019, a few short weeks to circle the globe, being declared a public health emergency of international concern by January, and soon after, a pandemic in March this year. It has also taught us that size doesn't matter, as the superpowers of this world are struggling to contain the virus, while our little nation has seen much success thus far. We have also learned that to succeed in this fight, We all have to work together as a unit with a laser focus on the task at hand, remembering that no one is safe until everyone is safe. Daily, we hear of agonizing milestones being reached as the number of persons infected globally continue to rise, along with an ever-increasing death count. To date, you just heard that there are more than 58 million persons infected and 1.4 million persons dead. We all expected or hoped for a quick solution to this crisis. Some prayed for the virus to go away like the seasonal flu so we can get back to the lives that we knew pre-COVID. Sadly, this pandemic has dragged on and appears at times to have no immediate end in sight. Because of this, COVID fatigue has set in, and persons are getting tired of being cooped up and careful and are desperate to return to the old norms. The virus has not shown any signs of fatigue, however, and is still seeking out new persons to infect and lives to claim. We therefore cannot pretend that the pandemic is over and that the virus is less dangerous now than it was in March. We are still in the middle of a global crisis. Despite this stark reality, we hear complaints daily. Why do we have to always wear a mask? Why are we demanding a negative PCR test 72 hours before arrival? Why are we insisting on a 14-day quarantine on arrival when other countries have a shorter period, just to name a few? We insist on these standards because they are based on science and have been proven to be effective. Just because one doesn't like the protocols and restrictions does not mean there is not a problem that still needs our undivided attention. These protocols are the reasons why we have remained a country with a low case count thus far, with no current hospitalizations and no deaths to date, and have made us an attractive destination to others. With our borders now open and as planes land at RLB and the ships pull into our ports and our returning nationals and visitors disembark, so will the virus that causes COVID-19. That is why we had case 20 on Saturday and cases 21 and 22 today. If we let our vigilance wear thin, we can expect to see an increase in spike in our COVID positivity rate and an overwhelming of our healthcare system, as we will be unable to capture and contain these cases when they arrive, leading to viral spread in our communities. We need not just focus solely on the increasing case numbers, however, but the containment measures as well. We have reached thus far in this fight as a nation through our collaborative efforts with the all-of-society approach, and should not let complacency set in and erode the gains we have made in containing this virus. A progressive cutting of corners in this fight will not bring back tourism and a thriving hotel industry. A progressive cutting of corners will not return us to the norms we were accustomed to pre-COVID-19 in a hurry. We have to first get through this wave with everyone alive and well, with the hope of building a brighter tomorrow when we have conquered the virus with an effective vaccine. I do understand the frustration when people say they want to get back to the old norms. I too want to get back there. Every single member of the task force wants to get back there, but it does not mean that we should ignore the risk posed by COVID-19 and abandon the fight. With the virus back in the Federation, our precautionary vigilance must be even greater now. We must do all we can to prevent the spread of the virus and prevent it getting a safe haven in our homes, churches, schools, and workplaces, leading to community spread. We must continue to avoid super spreading events, as I mentioned a few days ago, the parties, the fetes, concerts, balls, and mega indoor and outdoor events that we have grown accustomed to over the Christmas and Carnival season. These crowded, close contact events have delayed consequences. An asymptomatic carrier at one of these events can give you the virus to take back home to your loved ones. The effects of your action may not manifest itself until 2 weeks later when you or your family member come down with a cough or fever and later test positive for COVID-19. You may recover as your immune system fights off this virus, or the virus can win the fight, as we have seen it done so often in other countries. Don't make yourself associated with our first case fatality. When you put yourself at risk by attending these events or dropping your guard, you put others at risk, and many times it is those who you love. We emerged from the harsh lockdowns and curfews earlier on in this fight to a near complete opening internally, and now to the rest of the world. The end of the restrictions does not, however, signal the end of the pandemic. The virus will continue to come as planes and boats arrive with passengers. This fight must therefore be continuous and sustained. We must continue to do what we know work and got us safely through the 9 months of this pandemic so far. That is, continue to test all who need testing with the gold standard PCR test. Continue to quarantine those who need to be quarantined. Isolate those who are known to have active infections, and do all we can to avoid the spread through physical distancing, hand sanitizing, disinfecting frequently touched surfaces, wearing a mask, and proper cough etiquette. These measures may not be easy, but they are proven to be effective. We cannot allow our commitment to the measures used in fighting this deadly virus to fade over this festive season. Now is not the time to be reckless. Every day you rise, you must prepare and be committed to continue the fight, as your singular action can affect all of us. There are now 3 vaccines on the horizon, as you heard, that have great promise at ending this pandemic and getting us out of this global crisis. There is a light at the end of the tunnel. Let us continue to run the race together and make a collective surge to the finish line that is just now around the corner. We can get through these tough times, but only by working together, united in the fight against COVID-19. Thank you.
Thank you very much, Dr. Wilkinson, for your presentation. I now invite Superintendent Cromwell Henry, the Divisional Commander for District A, to give us a presentation with respect to the law and the regulations. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good morning to all. I think by now that we are all well aware of what the law says with respect to COVID and what our obligations are. And so what I said today would just be a reminder. We have heard the presentations of the Chief Medical Officer with respect to the new cases of coronavirus. And I must say that we are not surprised by the importation of the virus into the Federation. We have been preparing you for this eventuality over the last 7 months. The CMO has said previously that the virus will be coming back, and it will be coming on a plane with the reopening of our borders. The entry and other travel protocols were designed to identify and contain these cases of the virus when they come. Clearly, the process has worked. To date, the imported cases were contained and has not unnecessarily exposed our people to the virus. However, we must continue to be vigilant and do not let our guards down. Contact tracing, as explained, is a very important part of the process, and this is ongoing. We ask those persons who the health workers may contact to cooperate with the process as it is intended for your safety. We ask all to observe the protocols which are intended to prevent you becoming infected or to prevent the spread of the virus. The wearing of face masks in public, sanitize frequently, practice good hand hygiene, and adhere to the social and physical distancing protocols. These are all the non-pharmaceutical means or measures that are intended to prevent the spread and to keep us safe until we decide to take the vaccine. Thank you.
Thank you, Superintendent. I now invite Mr. Abdias Samuel, the chair of the COVID-19 National Task Force, to give his presentation. Mr. Samuel.
Thank you, Mr. Williams, and good morning to all. My job basically this morning is to reinforce what has been said before me. Again, CMO would have said it when we actually had the press conference regarding the reopening of the borders at the Royal St. Kitts Hotel Conference Room, whereby there was some infographic which said a plane and the virus returning to the Federation. We have spent a considerable amount of time preparing you for this event. There is no need for us to begin to panic or think that the country is going into a shutdown. What is being required of you is to be more alert, to be more vigilant. That is what is required of all of us. For example, Superintendent Henry just said, all the protocols that need to be followed, the guidance that is being provided by the health experts, the National COVID-19 Task Force, and I am asking the business community via the Chamber of Industry and Commerce to support the efforts in these business establishments so that they could adhere to the protocol. Compliance with the protocols are necessary. Again, we are seeing a number of irregularities as it regards to the approval process, where persons are attempting to circumvent the system with uploading wrong tests, wrong information, and doing other things in order for them to travel. You are jeopardizing the travelers who are traveling with you. You are jeopardizing the country at large and everybody else that you're coming into contact with. We are appealing to everyone who wants to travel to St. Kitts to do so and do so the right way. Again, what is the right way? You would have heard that you have to go to the knatravelform.kn, complete the form, upload an RT-PCR test as outlined by this Chief Medical Officer. Persons are actually uploading receipts. Persons are uploading things that cannot be verified. That will not be accepted. And let me repeat, such uploads will not be accepted. Please ensure that when you upload your test, it verifies everything, the lab, the location of the lab, the information, and all the regular information required. It's very important that you do so. If you don't do so, and there's no means of verifying these tests, your application will not be processed. I want to thank the team that is doing the vetting process, because they go as far as calling individuals, they email individuals to ensure that they understand what is required. So I want to thank them for that. Again, let me emphasize that the reverse transcription polymerase chain reaction test is what will be accepted, and not no rapid test or any other type of test. Please ensure there are persons who are doing home kit testing and uploading these home kit testing. Those will not be accepted. Again, there is no need to panic. The corridor of containment is working well, from the arrival process at our international airports or ports of entry, to the processing by our border agencies, immigration, customs, and also our port health officers, and the transportation. And an appeal was made by the CMO to those who work in the transportation industry in this regard, taxi operators and water taxi operators. Please be mindful of how you manage. We have been doing well with the corridor of containment in terms of detecting, identifying, and ensuring that there is isolation and management, or containment and management of individuals who may be positive or become positive. Business places, the Compliance Task Force will be out in its numbers doing its job. I am asking for you to cooperate with them. We have done enough in terms of educating you, in terms of doing everything to prepare you for this moment. From now on, we are going to be applying the law to its full extent to ensure that we have compliance from the business places, in terms of ensuring that you have the appropriate markings, ensuring that you're carrying out sanitization processes, and ensuring you have the necessary distancing on the outside. Please ensure that you have the necessary markings on the inside as well, so that you are full compliant with the regulations. We will be reaching out to the Chamber of Industry and Commerce to ensure that their members are compliant and they become a continued stakeholder in this regard. Let me appeal to the general public again to take the necessary steps to enforce and adhere to the protocols. We cannot ever overemphasize this. It's very important. And again, please avoid these super spreader events, and you would have listened to the passionate presentation that was made by the medical chief of staff regarding this. We are seeing a lot of events. For example, there were over 44 events that would have occurred. At the present moment, I am hearing that the Commissioner's office is bombarded with requests for events. I think this is a wake-up call, and I am asking individuals to be more mindful about these major events that can be super spreaders. With that said, we will continue to do our work in terms of engaging, consulting with all of our stakeholders. And again, there is no need for panic, as these cases are being managed and contained adequately. So we will now entertain any questions that you may have, and we will do our best to bring a level of calm to the country. Thank you, Mr. Williams.
Thank you, Mr. Samuel. And we would now have our questions. The first question: if everyone boarding a flight to St. Kitts and Nevis has a negative approved test, assuming pre-flight sanitation of the aircraft, how does a passenger arrive here with a positive test? Where might the loophole occur? Dr. Wilkinson.
That's why it's important first to know that someone can test negative today and positive tomorrow, because as the virus multiplies within the person, the levels can reach to a sufficient level such that it can be detected by the test being used. And this is why, one, we emphasize the use of the gold standard PCR test that has the lowest rate of false negativity. It is also why we emphasize using the lowest window, the smallest window of 72 hours with a negative test prior to boarding a flight. Now, all the persons who were on that flight tested negative on boarding, but through our serial testing mechanisms here, we were able to pick up the positive test. And so this underscores the importance of serial testing in our protocol also. So I would not say that there was any loophole, but what this has proven is that our system works, and that we were able to contain these three cases that otherwise could have slipped through the cracks and gotten into our community, leading to community spread. So we need to encourage the frontline workers, those at the airports, etc., to continue doing their due diligence. And we also need to continue with the protocols that we have in place, despite the fact that we have been getting significant pushback. But we do this to keep you safe.
I recognize that the Honorable, we would invite Dr. Laws to do a follow-up to Dr. Wilkinson.
All right, and so I want to thank Dr. Wilkinson for his response. I just want to add that as we continue processing the entry forms from persons who are coming into the country from the United States of America, we are learning quite a lot. And the team who are working on this project of processing the entry forms, we have learned that there is a plethora of COVID-19 assays and tests in use in the United States of America. And we've also learned that a number of these tests or assays are not fully approved by the FDA. They have what we call EUAs, emergency use authorizations. And so a number of persons who are applying to return to the Federation would have submitted negative test results utilizing tests that are not the gold standard, which is the reverse transcription polymerase chain reaction laboratory-based molecular test. And so the loophole, the question asks, what's the loophole? We really need to be very vigilant in terms of the quality of the test report submitted for consideration for approval. And so anybody who come into the country, they are subjected to serial testing, and so that's why we have picked up these 3 imported cases. And so yes, our system or the protocols that we have in place are very robust, and so they are working because we've identified 3 imported cases quite early. Thank you.
Thank you, Dr. Laws. I recognize the Honorable Vincent Byron, our Attorney General, who is here with us and who is chairman of the Mitigation Council. And I do have a question for him. It's been a while since we've seen him here. And the question is, does the COVID bill, the COVID Prevention and Control Bill, does it have a sunset clause?
Thank you very much, Mr. Williams, and good day to all who are listening to this very important briefing from our National Emergency Operating Center. The COVID bill was passed into law last Thursday in the National Assembly, and it was an important piece of legislation that is meant to bolster our framework in terms of response to the COVID. It is made up of a number of regulations that have been passed under the Emergency Powers Act, which is part of our state of emergency response to COVID. And we should have a number of these regulations that have now been put together to form the foundation of the Act as it now stands. But on the advice of the medical fraternity, Dr. Laws, Dr. Wilkinson, and their teams, they've also added some very robust pieces to that Act that gives us a very detailed way of dealing with returning nationals as well as visitors to the country. It's very important to understand that they have tried to work out all the eventualities that may happen. COVID is with us, and we do not know how long it will be with us. It may be a year, 2 years. And though we have had very good news that in the United States, they have been moving forward and have suggested that a vaccine may be available as early as December. We here in St. Kitts and Nevis and in the Caribbean, wider Caribbean, have to maintain our vigilance, have to be very careful that we keep in place the regulations, the measures that we have needed to protect us to this time. And so while one may ask for a sunset clause, when does the bill come to an end? We say that it will be in place as long as is required to fight COVID. The COVID is not to be played with. We want everyone, we urge everyone to be vigilant. You have heard it from our presenters today. Each one of them has laid out what we have done from the very beginning. Non-pharmaceutical measures that are critical in protecting each of us. The wearing of a mask, if you're in close contact with anybody, avoiding large gatherings, mass gatherings, sanitizing, sanitize your hands so that you don't touch your face after having touched infected places to transmit the virus. But we are also doing other things as well. And so all of these measures are intended to protect our residents, the people of St. Kitts and Nevis. And we ask that each and every one of us would adhere to those regulations, support the advice of the task force, the medical team, the police, and that we would get through this. This too will pass if we do what is right and we stick to it. Thank you very much.
Thank you very much, Honorable Attorney General. These next questions all have to do with infrastructure, and they are from Win FM. How many beds do we have? I suppose in terms of beds they mean for COVID patients. How many hazmat suits are available? The capacity of the isolation facility at the Joseph and France General Hospital. Drills conducted for emergency response people. Those are from Win FM. Dr. Wilkinson.
One of the things we said early on as we prepared for this pandemic was that we identified a site at the Joseph and France Hospital where we would house persons initially with our COVID-19 virus disease. And if the cases became overwhelming, we would command more and more of the institution. And so right now, we have the private ward that is identified with about 15 beds, each having a ventilator associated with the bed. And so the capacity on the private ward is 15 beds, but there is a plan in place to gradually command more and more of the institution, and we have 3 health institutions, and so our capacity can expand if we have an increasing number of cases. However, prevention is better than cure, and so that is why we are doing what we can to contain the spread. And when we speak about lowering the curve, we're talking about preventing an overwhelming of our healthcare system. As it relates to the personal protective equipment and hazmat suits, etc., I can't give you a figure off the top of my head, but we have used science in terms of figuring out the number that we need. And I guess later on we can get the operations manager to give us the exact figures. I don't know if the CMO has the exact figures, but I won't be able to give you those, other than to say we have a sufficient supply at this point in time. I think those were the...
Thank you, Mr. Williams. I just want to assure the general public that we have an inventory, a team monitoring our inventory at our central medical stores in terms of ensuring that we have adequate supplies of everything that we need in terms of all the pieces of personal protective equipment, PPE, adequate medication, etc. And so, and then the other aspect of the question spoke to drills. And so between January to present, the medical team has been exposed to continuous training and capacity building facilitated by consultants and focal points in country, and we are ably assisted by the Pan American Health Organization. I want to assure the public that even before we opened our borders, our internal medicine specialist team would have developed our COVID-19, the clinical management of moderate to severe COVID-19. So that's our national protocols for the management of persons who would become moderate to severely ill when impacted by this virus. And this document was made available to all health professionals in the Federation, and all health professionals were sensitized to the latest information regarding the clinical management of COVID-19. And so this took place even before we reopened our borders, and continuous training in terms of infection prevention control and the donning and doffing of PPE, etc., happens on an ongoing basis. Thank you.
Thank you, Dr. Laws and Dr. Wilkinson. This next question has to do with crowding and also air conditioning. What are the protocols for air-conditioned office spaces? No windows, only a door. Do we keep the door open all day or just periodically? And during the Christmas season, will the supermarkets limit the number of people shopping? Dr. Wilkinson.
Now, the science has told us that it is better to be outside than inside as it relates to COVID-19, because the droplets can stay around on particles and remain suspended for a significant period of time. And so, yes, if you are in an enclosed space, in an air-conditioned space, then your risk is greater than someone who is on a playfield on the outside. We have said, however, that we have to learn to live with COVID-19. And so that is why we ask you, when you're in an enclosed space, especially with persons who are not within your immediate family, you need to do the things that will protect you, wearing the mask and making sure that you sanitize frequently, because one should be able to get to a point where you can be around someone who has COVID, who you don't know, of course, but still don't catch COVID. And so we continue to emphasize the series of non-pharmaceutical measures that will keep us safe. We can't tell everyone that you need not be in an air-conditioned building, but while you're there, you need to make sure that you socially distance and do the things that we know will keep you safe. As it relates to the supermarkets, if you are to go to any of the supermarkets right now, you can actually walk in there, and they are basically not up to capacity, and there is proper social distancing, etc. And so if we continue on the path that we're on, we should be safe. Yes, there are periods during the Christmas season when persons flock to the store. I believe that one of the reasons why, for example, with the VAT day, we have 2 VAT days instead of 1, so that persons can stagger when they go to these places and be properly socially distanced. And when we speak about an all-of-society approach, we're asking the supermarket owners, etc., to help us. We're also asking you to make sure that you can stagger your shopping periods. And so if you went to the supermarket and you realize that there's a crowd, you can go back and come back at a later date. We have almost, 60 days before Christmas, and so you can start your Christmas shopping today, tomorrow, etc. You don't need to wait until December 23rd or 24th and rush into the supermarket with everyone, and then the place is overcrowded, then you say, oh, I believe that I'll be exposed. Okay, so we ask everyone to exercise personal responsibility in dealing with this over the Christmas season.
This next question, the person has made a comment and then a question. Perhaps that people coming into St. Kitts should be tested, then proceed to a place of confinement, tested again to determine whether they are COVID-19 free to travel to St. Kitts. And the person is asking if can the accepted COVID-19 test pick up COVID in its early stages? For example, can I be infected today, tomorrow do a test, and it is picked up? Dr. Wilkinson.
I just want to tell that person that we welcome all suggestions and we take everything on board when we are planning our way forward, and we use the best science to guide us. And so we will look at what you say, and we will continue to look at the science and determine how we formulate our protocols. It doesn't necessarily mean that every suggestion by every single person will appear in our protocols, but we'll use the best that we have. And so right now, based on the science, the protocols that we have in place are the ones that we're using right now. I said just recently also that one can test negative today and positive tomorrow, because the virus have to have a certain load in the person's body to be picked up by the test. And the test that has the greatest specificity and sensitivity is the PCR, the RT-PCR test that we use. And so we continue to use this PCR test to determine who gets on a plane and come to St. Kitts and Nevis.
This individual is raising some alarm. Thank you, Dr. Wilkinson. I would like to know what is the position for the cleaners of the American Airlines. As a family member cleaned on Saturday and Sunday and went to Reality's home, they're saying that they're scared. Is there anything that you can do to assure them? Dr. Laws.
Mr. Williams, as we would have said before, all persons, all frontline workers at the airport in this industry, they were exposed to training. So all the cleaners, they were exposed to training, and they were trained with regards to the protocols that were developed. And so the cleaners would know how to operate in the context of COVID-19. As a matter of fact, in all of our trainings, we would tell individuals, please operate as though the individuals on board were infected, and so they would be attired properly in the appropriate personal protective gear, PPE, and they would be, once they adhere to the protocols, everything would be safe. I want to just underscore the last two, the two cases that we are highlighting today, the latest two imported cases. They would have arrived in the Federation on Saturday afternoon, November the 21st. All right? Now, these two individuals would have traveled along that corridor of containment between disembarking the plane and reaching the hotel. So they were only exposed to frontline workers. Please note, frontline workers in this industry, they were trained, they have been trained, they are all properly attired to deal with situations like this. So only individuals who are working on the front line, meaning in the arrivals area at the RLB airport, the medical screening unit, immigration, customs, they would have been dispatched by the dispatcher. They would have been channeled on the COVID-19 transportation directly to the hotel. I want to assure the general public that these two individuals, they were confined to their rooms from arrival. So their only interaction with locals would be those on the front line, and everybody on the front line, they are appropriately attired. they have on the proper PPE in terms of face masks, surgical face masks, disposable gloves. Their hands would have been sanitized, and they would have followed the protocols developed for dealing with such. And the same thing goes for case 20. All right, so the only interaction with locals would have been persons working on the front line, and all frontline workers have been trained, and there are established protocols to guide how they operate. So I wanted to reassure the public in this regard.
The next question has to do with, the person wants to know what provisions are made in terms of the quarantine fee for frontline workers if they test positive after coming in contact with an infected person. Dr. Laws.
I want to assure the general public that the health and safety of our people are of paramount importance, and if there are issues in terms of payment of fees for quarantine, they will be quarantined. We'll make sure everybody is safe, and so that's not the focus. The focus is ensuring the safety, the health and safety of our frontline workers and health and safety of our people. So, for example, the contacts of the cases so far that have been placed in quarantine, as far as I know, there isn't an issue in terms of quarantine fees and cost. We are just ensuring that these individuals, they are safe and they are healthy. Yes? Thank you.
This question is from Sugar City FM 90.3, and I would invite Mr. Samuel to address that, and then afterwards he can make a statement. Could you tell us what became of the 311 hotline number? Mr. Samuel.
Okay. Thank you for that question, Mr. Williams. The 311 hotline was being manned by a number of volunteers. At the present moment, we are restructuring the entire process. And once we have restructured the process, we will then communicate to you, the general public, and everyone else when the 311 hotline again will be activated. All right? Thank you. Oh, Mr. Williams, well, thank you. We have been appealing for calm within the general public. Just a few minutes ago, we received information that a particular teacher at a particular school would have been exposed to someone who works at a particular hotel. From the information that we have, there are no known positive COVID-19 tests at this particular hotel. However, we noted the concern. This information will be forwarded to the medical team, and then the necessary actions will be applied as advised by the medical team who will do their investigation. We are appealing for calm. Let us not go use the tool of misinformation or fake news as we know it to cause any type of hysteria in the general public. I think we have the country under control. I think we are doing an excellent job in terms of containing these COVID-19 imported positive cases, and we will continue to do so. Everyone who has a level of influence, I am advising or appealing to you to use your platforms to share positive information so that we can move St. Kitts and Nevis forward. There is no need for us to go into any type of hysteria or panic or chaos. It's not necessary. We are being transparent with you, and we are sharing the relevant information with you, and we are also interacting with you with these questions and answers so that you could have the information right from, from the relevant authorities. Again, let us avoid misinformation, and I am asking everyone to condemn any type of misinformation campaign to destabilize the country. So, thank you, and thank you very much, and we are seeking the cooperation of everyone in this regard.
Thank you very much, Mr. Samuel, for helping us to understand that we have to keep the calm and do what we're supposed to do. The other question is for Dr. Laws. Are babies under the age of 3 also tested for COVID upon entry?
Mr. Williams, children who would have returned to the Federation are tested. We've tested babies, as young as 1 month old. And so, yes, children, once you would have returned to the Federation, you're not exempted, because as you can see, based on CNN's latest report, there's a spike in the number of children in the U.S. who have contracted COVID-19. And so here in the Federation, children are not exempt. And so once you would have come back, we test all children. And we've not had any problems so far. I want to assure the public that the public health team, they're very experienced now in taking that sample. And so babies have nothing to fear in terms of, getting that sample taken and the sample being processed by the lab. So there's nothing to fear in that regard. Thank you.
This is our last question for the day. With these 3 new cases, is there any concern over the results being submitted before arrival? Dr. Laws.
So, Mr. Williams, I think that's a lovely question, to end this press briefing. And so, yes, these 3 cases have taught us that we need to be very serious about accepting the gold standard, and that is the reverse transcription polymerase chain reaction laboratory-based molecular COVID-19 test prior to coming to St. Kitts and Nevis. If we stick to that, we will be in a good place in terms of repatriating our nationals and international travelers. And so that's one takeaway lesson from these 3 imported cases of COVID-19, because yes, they all had negative pre-arrival tests and they converted to positive. And so it's very important for you, if you're coming to St. Kitts, your pre-arrival test must be the gold standard, the reverse transcription polymerase chain reaction laboratory-based molecular test done within 72 hours of travel. So if it's 4 days and 5 days, we will not accept same. So the window, you have a 72-hour, 3-day window within which to have your sample taken, results processed, you upload it onto the platform, and then we provide you approval. And so that's the takeaway message from these 3 last or additional imported cases. Thank you.
That brings us to the end of our press briefing for today and to the question and answer segment. I want to thank all of you who have joined us today for your participation, your attention, your questions, and your concerns. We thank you very much. And I want to thank those who continue to answer your questions, who continue to manage the COVID-19 pandemic here in the Federation. I thank firstly our Chief Medical Officer, Dr. Hazel Laws, for the work that she's doing. Dr. Cameron Wilkinson, our Medical Chief of Staff, who is also doing very good work, Mr. Abdias Samuel, Chair of the COVID-19 National Task Force, Superintendent Cromwell Henry, who always provides us with respect to the law, what we should be doing and what we should be following. And he doesn't speak much about penalties, but penalties we know will come. We thank Honorable Akila Byron Nisbet, the Minister of Health. We thank her for her support. And the Honorable Attorney General, Vincent Byron, who is Chair of the Mitigation Council. Thanks to Mrs. Christmas Jacobs, who is very faithful in providing us with the sign language, and to ZIZ and all the media. Their work is very important in helping us in this pandemic fight. To all of you, thank you, have a good lunch, and we will be back tomorrow, Wednesday, for our regular briefing. How can we forget Ms. Vesta Southwell, who is also part of the NEOC communication team. Thank you very much, Vesta. See you tomorrow. I am Les Roy Williams.
Is on.